This morning, an exclusive look into how Tampa General Hospital is handling a spike in COVID cases. The mass amounts of time, space, and resources needed to save lives.
Handling the surge in patients coming into the hospital can be a daunting task. Marco Villarreal went to the hospital's command center and joins us with more on how the hospital is using technology to treat and release patients efficiently. Marco.
Hey, good morning, Chris and Avery. Well, the latest update from Tampa General is that they are running right now at a code yellow in hospital bed availability for COVID-19 patients. With 231 COVID admissions and more than 100 ICU beds in use, hospital staff have to be smart in how they rotate patients through. And part of being smart is letting even smarter people help out.
What you see right to my left is what we call the wall of analytics.
Dr. Peter Chang runs the GE Healthcare Command Center. They call it CareCom. And this is where they can monitor the number of patients coming in, where they are in their treatments, their discharge procedures, and even how those patients are doing once they go home. He compares it to air traffic control at an airport. Here, though, he says the goal is to make the patient experience the best possible, and he says this is badly needed since about a third of all adult beds right now have COVID-positive patients.
I can tell you exactly where a patient is in the discharge process. I can tell you what delays they may have. We use artificial intelligence and predictive analytics to look at where those patients are going to go to when they get discharged from the hospital. It's really, really neat. It provides us so much more information than we had in the past just operating out of our medical record system.
CareCom also allows the hospital to move patients around as needed. Depending on the amount of patients, they sometimes need to convert certain areas of the hospital into COVID wards.
I mean, they just must be so overwhelmed here. But so what goes into making these COVID wards?
Right. Well, obviously, we have to keep the patients, the COVID patients, separate from other patients so they don't infect others. So they have to make these negative pressure rooms. So they'll take a ward and they'll make these rooms, they'll put these filters in there and these kind of air units in there so that when a doctor goes in or a nurse, it sucks all air into the room, but none of the air that has the COVID particulates out into the hallway and affects other people. So it's a lot of work to do, but because of this command center, they're able to do that as efficiently as possible.
Wow, incredible efforts there at TGH.
Isn't that amazing?
Yeah. All right, thanks, Marco.